Picture this. There's a scared little girl lying in a hospital bed with dozens of bruises all over her body. She's hooked up to about 5 IV machines and has no idea what is happening to her. Her My Little Pony matching game that she played with her mother the night before is still resting at the foot of her bed, along with her favorite blanket. Tired and missing her home, she waits patiently for her family to bring her McDonald's for dinner. Immune thrombocytopenic purpura, more commonly known as ITP, is defined as, quote, a rare bleeding disorder in which platelets are destroyed, end quote. However, this disorder is a little bit more complicated than just that simple definition. First off, you have to know that our body produces tiny cell fragments called platelets. The platelets are created by cells called megakaryocytes in the bone marrow and released into our blood. Platelets are an essential part of our body's healing process. If one of your blood vessels is torn, it sends out signals to the platelets, which then come to the site of damage. Once at the site, they form a wall-like structure or clot to stop the bleeding and allow other cells to help create a scab. Another important concept is that our spleen produces antibodies. An antibody is a cell produced by the immune system in response to the presence of a foreign harmful substance called an antigen. In other words, every time that a virus or bacteria infects us, the immune system sends antibodies out into the bloodstream to latch onto and destroy the virus or bacteria. When a person has ITP, the immune system is stimulated to produce excess antibodies which mistakenly view platelets as harmful antigens. Since the platelets are viewed as being foreign, the antibodies will then latch onto the platelet surface and destroy it. This is why ITP is called an autoimmune disorder, which means that it is a person's body fighting against itself. Today, doctors are still not sure why this happens, and the disorder is often referred to as idiopathic, meaning, quote, any disease or condition for which the cause is unknown. Despite not fully understanding what causes the antibodies to mistake the platelets as a virus, the main focus of ITP is on the patient's low platelet counts, which causes many problems since they are unable to properly heal. There are two different forms of ITP, acute ITP and chronic ITP. Acute ITP is the most common form of the disorder and usually affects young children between the ages of 2 to 6 years old. This form of the disease may be caused from a small viral illness such as chickenpox or measles. This is because when a child has an illness, the body may temporarily overproduce antibodies, which can also temporarily lower the child's platelet count. However, the symptoms of acute ITP resolve in less than 6 months and treatment is often not needed. Chronic ITP can happen at any age and the symptoms can last a minimum of 6 months, several years, or even a lifetime. Adults have this form more often than children do, but it does affect adolescents. Chronic ITP can recur often and requires continual follow-up care with a blood specialist or hematologist, and it is estimated that 50,000 people in the U.S. are currently living with this disorder. Though the duration in acute and chronic ITP is different, their symptoms are the same. One of the most common and easily seen symptoms of ITP is the excessive bruising. This is because every time that we even slightly bump our skin a little too hard, we are breaking blood vessels. However, this is usually not noticeable because in a healthy person, thousands of platelets are constantly circulating in their blood to heal these broken vessels, and they can carry on with their daily life. With ITP, there are simply not enough platelets to heal even a small paper cut, so daily actions for people with ITP become dangerous with the risk of easily bruising. Other symptoms of ITP include superficial bleeding into the skin that appears as pinpoint-sized reddish-purple spots, also known as petechiae, frequent and long-lasting nosebleeds that are hard to stop, blood blisters on the inside of cheeks, bleeding in the mouth, bleeding in and around the gums, blood in the patient's vomit, urine, or stool, debilitating fatigue, depression, or low mental and physical energy, and the most dangerous yet rare symptom of ITP, which is bleeding in the head. The range of symptoms a patient can develop all depend on the specific person's platelet count. The average healthy human typically has a platelet count of 150,000 to 400,000 per microliter of blood. A person is still not at a huge risk for bleeding, even with a count of 60,000. However, the lower the platelet count drops, the worse the symptoms become. And it is extremely dangerous for a patient to go under a platelet count of 20,000 because at this point, the body can just spontaneously bleed without coming into contact with anything. If a person starts to notice the symptoms of ITP, they should see their doctor as soon as possible. Although ITP is difficult to diagnose and is often called a diagnosis of exclusion. This basically means that to accurately diagnose diagnose a patient, the doctor has to first rule out all of the possible disorders that have similar symptoms. First, a doctor will perform a complete blood count, or CBC. This measures the size, number, and maturity of different blood cells in a specific volume of blood, focusing primarily on the amount of platelets. Doctors can also perform a bone marrow biopsy. This is the removal of bone marrow by inserting a long, rigid needle into the hip bone or breastbone. A piece of the patient's bone marrow is removed, and the cells are then studied under a microscope by a pathologist who looks for signs of cancer. The right image is of the bone marrow in a normal, healthy person, whereas the left image is the bone marrow of a person who has ITP. As you can see, the ITP bone marrow has many more megakaryocytes than normal, and they have a darker purple color. This is because the megakaryocytes are in overdrive, trying to produce more platelets as they keep being destroyed. Once officially confirmed that the patient has ITP, there are different treatment options available the doctor can choose from. The most common treatment for ITP is prescribing corticosteroids such as Prednisone. These medicines work by blocking the immune response of the body and ultimately decreasing the number of antibodies made against platelets. The length of one course of treatment depends on the body's response, but is usually finished within a few months. However, the side effects of this treatment include weight gain, high blood sugar, sleep difficulties, and fluid retention. Another common treatment is Ivig, which stands for intravenous immunoglobulin. This treatment is relatively new and was first trialed in 1980 on a 12-year-old boy with severe ITP. Ivig contains proteins that bind to antibodies produced in the spleen and keeps them from destroying the body's platelets. As many as 20,000 donors are needed to make one batch of Ivig for an infusion. An infusion takes approximately 24 to 36 hours and is given directly into the bloodstream. Although it is not a permanent fix, the effects of an infusion occur quickly and can last up to 4 weeks. However, because a batch of Ivig comes from so many people, a patient may experience side effects such as headaches, vomiting, fevers and chills, decreased blood pressure, and nausea. A last resort treatment that doctors can perform is a splenectomy. This is a surgery that removes the patient's spleen, and doctors typically only perform this procedure on adults who haven't responded to other treatment options. Removing the spleen would decrease the production of antibodies that are attacking and destroying the platelets, so your platelet count can normalize. The problem with this surgery is that removing the spleen can put a patient at risk for other viral and bacterial infections, since they would lose a huge part of their immune system. However, it is effective for curing ITP about 65 to 70% of the time. At the beginning of my speech, I described to you an image of a little girl in hospital. Well, that little girl was me. When I was about 2 years old, my mother was deployed in the Middle East, and it was my dad who started noticing that I would get humongous dark bruises all over my body with no explanation of why I got them. Within a few weeks of this occurring, he took me to Doctor's Hospital to see my pediatrician, and he took a sample of my blood. One day, my dad received a call that my results had come in, and I had a platelet count of 58,000. As the catastrophizing person that he is, my dad initially believed that I had leukemia, but the pediatrician wasn't completely sure. My dad called my mom to tell her the news, and it turned out that she had gotten sick in Kuwait and was coming home. The day that she got back, together we all went to my first oncologist appointment. This is where I met Dr. Bell and the hematologist team, who would end up completely changing my life forever. During this appointment, I was admitted into the hospital for having a platelet count of 12,000, and they initially guessed that it was ITP. However, to confirm this, the doctors performed a bone marrow biopsy on me. Once confirmed, and while I was still in the hospital, I received my first Ivig infusion and was prescribed Prednisone. I was taken out of preschool, and every week on Friday, I had to go into the hospital to get my finger pricked and platelet count checked. Every month, I would also go into the hospital to receive another Ivig infusion and a new prescription of steroids, which gave me severe side effects. During this time, I honestly didn't do much, mainly because I simply couldn't. With the high dose of steroids that I was on, I was unable to walk and could barely even speak. Unfortunately, after about 2 long years of this monthly routine, the Ivig began to give me a horrible reaction called serum sickness. Every time that I would receive this infusion, I would get a very high fever of about 105, accompanied with vomiting and headaches. My parents decided to try an alternate route, and at that point, there were only 2 other options left: a splenectomy, or a treatment that wasn't very popular in the US, but one that Dr. Bell had recommended we try. She prescribed me a medicine called Rogan, and after about my 4th treatment, my platelet counts had risen to the normal level. My 3-year journey of dealing with this disorder had come to an end, and I was finally cured. My entire life, I've been told that if it were not for Dr. Bell, I would be a very different person today and may not even be alive. It is amazing to me how even one person can have such an important impact on your life, and I am so grateful that Dr. Bell impacted mine. She was also instrumental in helping me with the speech through several different interviews. If I had never been cured, who knows what could have happened. I definitely wouldn't have been able to do even half of the things that I love doing today, and my life would have to be very sheltered. I know that you probably had never heard of ITP before walking into school this morning, and I hope that my speech gave you a better understanding of the disorder. But more than that, I hope that each and every one of you appreciates your health and the abilities that you have. Because though we all take it for granted at times, our health can be taken in 1 second, and it is important to remember how truly blessed all of us are.